Today is World Stroke Day, a day bringing awareness to the leading causes of disability in the U.S. And here with more, Allison Gibson, or Allie, as you like to be called.
Please.
Glad to have you here. Also, a stroke survivor. So again, glad you're here with us.
Thank you.
And also Dr. Brian Weissman, Medical Director of UTMC over at UT right now, Comprehensive Stroke Center. So thank you, Doctor, for coming in.
You're welcome.
First of all, let's just talk about stroke in general. Who's at risk? I mean, as far as the age groups, who needs to be concerned?
Well, we're all at risk,
Everybody.
really. Yeah. Obviously, as we get older, the risk increases. But stroke can affect anyone, any age, any time.
Are there things that we need to be thinking about then to make sure that we're not, as we get older, that we're not in that high percentage group that could possibly fall victim to a stroke?
Well, I think one of the important things is knowing your risk factors for stroke. You know, high blood pressure, high cholesterol, diabetes, irregular heart rhythm called atrial fibrillation. Those are some of the common risk factors for stroke. And so knowing your risk factors and treating those risk factors is very important.
Okay. Allie, I got to ask you, now, we were just talking at the commercial break.
Yes.
It's been a couple months.
It has. It's been 2 months since I had a stroke.
And you said you're feeling pretty good.
I feel very good.
But you didn't know you were having a stroke.
I had no idea whatsoever. I had just finished eating dinner with my husband and was talking to him, and that's when he said, your face is distorted. On one side it's drooping, and your speech is slurred.
Wow.
In typical female fashion, I came back with, I'm perfectly fine. I'm fine. I wasn't fine. I was anything but fine. But thanks to his realizing the signs and getting help right away.
I would say that's the key, because time is of the essence at this point, right, Doctor?
Absolutely.
Yeah, and there's kind of I guess, a checklist we need to think about here. Was it Be Fast? Or is that
yeah, that's the acronym we're using now. B stands for balance, E stands for eyes, F is face, A is arm, S is speech, T is time.
Okay.
And so those are a lot of the stroke signs and symptoms that kind of give you a clue that something wrong is going on. And sometimes the person that's having stroke doesn't even recognize it.
Well, as you said, you didn't even have any clue.
None.
You were feeling perfectly fine.
Yes.
And just all of a sudden the symptoms started to move in, but your husband acted quickly.
Yes, he did.
How much time do we have?
Really, time is of the essence. So every minute that goes by, there's about 2 million nerve cells that are lost.
Oh,
that's a huge population of brain cells that you lose just like that.
Right.
The quicker you get into the hospital, and Ms. Gibson got in within 40 minutes of the onset, which is amazing.
Right.
The quicker you get in, the better chances you have of a good outcome.
All right. So a lot to think about. And again, if you think you see something, obviously go ahead and act on it quickly. Save a person's life, that's for sure.
Yes.